Oh, what's up, my support fibromyalgia friend? It's a very early morning for me. We're celebrating Giving Tuesday today, so I'm jumping on here to give shout outs to all the amazing people who have donated so far. We are diving deep into Meta Universe so we can get a meta match. How are you doing out there? Please leave an emoji. Please like and share this with all your friends because today is all about Giving Tuesday, and I know there's going to be a lot going on. So bear with me as I post. I post updates about our programs at the Support Fibromyalgia Network, and I'm going to be giving special shout outs all throughout the day as long as my power stays on, to all the special people hosting a fundraiser right now, and to those that have donated to the campaigns. I know who you are. If you want a special gift, shoot me a message and we'll definitely get one to you for hosting a fundraiser. It's going to be an amazing day, and I'm up extremely early over here on the West Coast. But this means a lot to me to continue to fundraise for funding hashtag fund fibromyalgia. It's an important cause to help fund all the fibromyalgia programs and unleashing generosity. You're going to hear me say this quite a bit throughout the day. We're unleashing generosity for the fibromyalgia community. So we have some asks that we're going to go through, and then I'm also going to do some separate videos. Going to jump on here to say hello and talk about the program so you can learn about the work that we're doing and where the funding goes to, because it's really important, right? Ask your questions, get involved, and there's so many ways to give today. And so, if you can, host a Facebook fundraiser because we are trying to get Meta to match it. Or if you're on YouTube, you can donate through our link tree or donate through our website through PayPal or YouTube itself. On Twitter, if you're out there, please share and do share our content. And then you can also donate. We'll be posting a link tree and other ways to donate through Twitter as well. So there's so many ways to do this. We are looking for dollar donations. We have some people that are going to be matching the donations as well, which is going to be a lot of fun. So you have so many ways to give between PayPal, Facebook, YouTube, Google, Venmo, Linktree. We have things set up that you can make your donations, and hopefully it's really seamless and easy. Let me know if it's not, because I'll go in and fix it right away today. But okay, so it's not just about dollar donations. We really do need some volunteer support. We need more fibromyalgia warriors and caregivers and businesses and healthcare professionals, researchers to get involved with the organization. So you can make an impact in patient education, medical education, because we are launching the Fibromyalgia Echo next year. Research, we want to do more GIS research in our own surveys on food access, add some more diversity to the research culture, and then, of course, expand our advocacy training. So we need more advocates around the country to join us for virtual Hill Days, to experience what it's like to advocate in their local cities, to run proclamations and more for public awareness during May and actually the entire year, right? 365 days of the year, we live with fibromyalgia. So we might as well doing public awareness all the time. But it's a great way to get involved with the organization at a grassroots level, and you can really feel the impact you're making for the fibromyalgia community. And it's important because you run off of a lot of donations of your time and energy. So if you can't make a dollar donation, or if you're interested in getting more involved, please consider volunteering your time and energy for all of this. And so make an impact that way. And I know, Mark, you're still looking for some help with SSDI, and that's what we're searching for. If someone can volunteer their time to help Social Security disability, it's something that we are looking to build. And our friends at Patients Rising have created a new program, and there's some advocacy going on, but we're going to have to do the work. And that's the path has not been laid down for us. And that's why we're working so hard here to get things done. It's hard. I've been in this space. I've had fibromyalgia for over 20 years. I was diagnosed as a teenager. I thought the work that I was doing some in the early 2000s was going to add up, but something is happening. Something is not changing. So how can we knock down the barriers to create sustainable, long-lasting change? And so this is the hard part. And like Mark is saying right now, I hear you, Mark, and we need to find experts. I'm not an expert in Social Security disability, but if there's someone out there watching, or if you share this video or you know someone, tag someone that is, because even if we can do some webinars, do some workshops, anything to be better advocates to help the community get the resources that they need, we need to increase that, because my story with a journey with fibromyalgia is not unique. A lot of the adversity that I faced is still continuing, and I hear that in your stories today. That's why we got to break down the barriers and create long lasting, sustainable change so that the work we're doing right now continues and nobody has to redo the work later, because that's what it seems like. We, and I don't, we're working really hard to break the change. We have to focus on collaboration. Collaboration is going to be the key. And so we will get this worked out. And Mark, I'm so glad you have, that's much further than I got. That's why I don't feel like I'm an expert, because of the adversity I faced. And I was told I was too young. Everybody kind of laughed at me and couldn't approach it. So there, Mark, you're getting your some rallying support, right? So that's what this is all about. The community is coming together. We are coming together, and I see Sherry taking, and Sherry, that is awesome too. Like 2 years is a short amount of time. I have talked to many people. It's taken them 8 years. We have to improve the process, right? Have to improve this process. I've heard people in support groups, it's taken a long time, a lot of denials. So that's part of it, right? So the first part, and let me just get into a little bit. I know I love answering comments and just going through and giving people shout outs when it comes to this, but we're going to keep fighting for everything and aspects of it. And so one part of this advocacy training is not only for fibromyalgia, right? So we've worked with a lot of advocates. We're trying to build confidence when it comes to talking to representatives. So we start with fibromyalgia, but we've actually been doing a lot of work with the Patients Rising delegates. So I myself am learning more, and I think that's a great outlet to get involved with. And it's another organization that can teach other aspects of advocacy because they have a master's class. So that's what we're all about here with the Support Fibromyalgia Network, sharing these resources so that you can get involved. If you're really passionate about it and all that's happening, and you've faced adversity and want to join and make sure that no one has to manage that same adversity, and you feel it in your heart, you're like, I got to change things, reach out, because this is what I do. Wake up every morning thinking about all of you in the fibromyalgia community. I go to sleep thinking about you in the fibromyalgia community. All the adversity I faced for 20 years. I was writing and journaling. I was kind of on the sidelines. I was doing some volunteer work with other organizations, doing what I could with a body that never worked. But now that I've gotten a second opportunity at my health, this is where we're just running with it. So we want to show our support today. And that's why Giving Tuesday does mean a lot to us. And again, it doesn't have to be dollar donations. You can get involved by sharing your story. We have an outlet to share your story on a blog. You can come on if you're interested in doing a live interview, or we can do a recorded interview, and you can share your experience with others, because many people feel the same way. And let's figure out how to create the change we need together. We are rallying advocates around the country because we need to support all the advocates out there. And by advocates, I mean like support group leaders, bloggers, vloggers. So we got to support each other. We got to collaborate, because making sustainable changes for the fibromyalgia community is so much bigger than one person or one organization. So one of our huge goals is to bring the community together and help establish better patient education, empowering patients. So bringing you the education straight to your homes, showing you how to utilize it. We did a health coaching pilot program where we were health coaching 12 participants. It was just a pilot program. I'd love to grow it for more. Obviously, it takes some financing. We're trying to do some research behind it so that we can create more specifically health coaching for fibromyalgia programs. And that would be amazing. We had some good results from it as well. And this is where you learn to be an empowered patient. You learn to improve your quality of life, and we give you the information directly. we are also working on democratizing medical education for fibromyalgia. So that's going to be a huge project. We need advisors to get involved. If you want to nominate your doctor to get involved, or another healthcare professional, if you're a retired healthcare professional, or you just love building curriculum, maybe that's what you've done in your past. And especially, we love our teachers, we love our nurses, they do a great job. So we need some support with the Fibromyalgia Echo program. It's a Project Echo model, and it's all about democratizing fibromyalgia medical education so your providers can get the knowledge, updated training all about fibromyalgia wherever you live in the country. And then we want to expand it internationally. So I see my international friends here. Rob, hello. We want to do more internationally. So we need advocates to rally. It's complicated to work with other people, I've noticed, but I'm hoping we can get the message across, and you can share this with the other people and the other organizations around the world, that we're open to collaboration, and we need collaboration because it makes a difference. So that's another way that you can give back today, and you can unleash the generosity on the world. We're going to be doing some more videos all across the internet. We're going to be sharing. We're going to be doing it on LinkedIn, asking for professionals to get involved too, because we really need to make a difference in the medical community. And then we're expanding research development. We would love to fund more projects like the fidget study, and you can check out that link for that. We'll be posting throughout the day. We did an interview with a researcher. And then things like Younger Lab, right? It'd be amazing to be able to fund specific research that we know will benefit the fibromyalgia community directly. We are pushing for the NIH to give more funds to fibromyalgia through our advocacy work, and it's working. And we're making a direct effect, and we're letting our representatives know that it matters, and we need an investment for reclassification. We need pathophysiology. We need to understand the underlying cause of fibromyalgia to increase better treatments. So that is in the works, but we're also funding our own research. We're doing food access surveys, increasing diversity in the research, because we're noticing that that has been an issue. So there's a lot of stuff going on, and we want to grow, but we can't grow without volunteers and people donating your time. So again, if you want to write a blog, if you want to share your story on a blog, if you have a skill set, if you want to become a patient advisor, we need actually more patient advisors for the Men with Fibromyalgia program and the college program. So there's a lot of different ways that you can get involved if you are interested also in joining the board. Applications are open as of December 1st. So that's a great way to get involved at a grassroots level. And any just sort of donations as time, like business skill set, if you want to share, like I said, if you are understand Social Security disability and would like to share your knowledge with the community, we are all for it. So interviews, sharing your experience. If you are another healthcare provider and want to outreach to some other patients, want to join the Fibromyalgia Echo, we really appreciate it. Let's see, there's so many ways you can host a fundraiser. Definitely, like, think about hosting a Facebook fundraiser or one of those birthday fundraisers or Giving Tuesday fundraisers. We also, whenever we can go back to safely doing events, we would appreciate any sort of in-person fundraisers. If you have a business and want to donate proceeds, that also helps. So if you also run an eBay charity, you can donate proceeds to the Support Fibromyalgia Network. We also work with advocates who have businesses, and the best example is Heart, Faith, and Strength. We show so much gratitude to Nikki. So she has her business store. You can go support her, and she does donate proceeds to the organization. And then what happens is we've created a sort of a give back program for Nikki and her community. So this is what we like to do. We don't like your dollars to just go into oblivion, and you don't know what kind of impact it can make. And so we allow people that collaborate with us to direct the funds back into the fibromyalgia community. And so for her, it's donating back into the community to create a better support system for South Carolina and the people. And she's also working on this holiday giving program that we have right now. So what happens is the funds go into this holiday giving program where we're supporting an individual and giving them a care package or a grocery delivery this holiday season because they're really in need. So it's all about collaboration. We hear from the other advocates, they tell us what is going on and they work together with us. So that's an important part of the work we're doing. And I see with Rob, the problem the kids still don't. Rob, we need to change this. Like you said, 20 long years and of also continuously hearing that fibromyalgia is not real or the wastebasket diagnosis. That is so rude, right? We're living with symptoms and some of the ways that it's talked about, and you're just like, well, then what do I have if fibromyalgia is not real or it's a wastebasket diagnosis? And I never got a good answer. So we're going to be changing that language right away because we just have to get rid of this. It's been way too long. We know that it's a real condition. We all live with the symptoms. We all know what it feels like to live with fibromyalgia. So we are making changes. I know it's going to be a totally different game in the UK. I'm hoping the UK is more open in the United States to break through those barriers. I've heard people breaking through. There's a lot of stuff going on, so I know that it's still a struggle here in the United States for all of the feedback we get everywhere across the world. Fibromyalgia's definition is different. So that's why this investment on the side, the advocacy that we're doing to invest in the government agencies need to do the research so we can have a universal way of defining fibromyalgia across the board and then a classification that makes sense. Right now, even in the United States, it's classified in a different house where we are trying to work on getting it reclassified as a neurological condition to match the American College of Rheumatology because it's inconsistent all over the world. And I know in the United States it's very inconsistent. So doctors aren't getting the correct information depending on what outlet they look at. They don't have enough resources. And even the CDC has it under arthritis, where if you talk to arthritis foundations, they're like, it's not an arthritis condition. So, or you talk to doctors. So we need to get this nailed down. It's really important. It's part of this advocacy work. Um, and we would love to, and Rob, I would love to just have a conversation to figure that out on how we can advocate and how you can advocate. Cause I know I've reached out to some of the UK advocates and then I've reached out to some of the organizations. I have not heard back. And I think with fibromyalgia, like again, we're changing the landscape by collaboration, which is new. It's a new experience because we can't compete, right? Fibromyalgia, improving the quality of life for all of you. It's going to be larger than one person or one organization. There's only so much that we can do here. We're limited. So we're going to have to find people across the world that are willing to chip in. A shout out to Carrie from Taiwan and My Several Worlds. She's been doing what she can over there to increase fibromyalgia awareness. So Rob, maybe that's a good connection to see like what she's doing, what she's building. I don't know if that interested you at all, but this is why we support our bloggers, our vloggers, because they get the word out. Our support group leaders, sometimes there's support groups all across the world, or they have even Facebook groups. Anything that you can do to share your experience with others and then be a better advocate. Like, I want to know the process for advocacy in the UK. So we're figuring it out in the United States. It is quite a task, but to work together and get what we need, and just trying to figure out how to help people because there's a lot of people that need assistance right now. We've seen it in the comments about disability services, and we need to go off on the spectrum, right? Easier to get disability service, but what if we could actually go and prevent this from even happening? So if you're newly diagnosed with fibromyalgia, you get all the information you need at possibly preventing you from declining. Is that possible? I don't know. We're still working on the science of understanding fibromyalgia, so we'll get there. But that's what having these conversations and consistent conversations with all of you. And I will definitely reach out to Rob. And again, it's like, please be please connect with each other in these comments because we need more men with fibromyalgia. That is something that actually we want to advocate for and create a better program for and resources. Obviously, I'm a female, so I'm doing what I can to support the men in the group. But we need more voices. We need voices to come together and support the men. We need more voices to come together to support youth. I was diagnosed early in my teenage years, and I was always told that it was rare for people with fibromyalgia to be diagnosed so early. And I know that the men hear this as well. Like, that's probably part of it too. I've even heard a fibromyalgia specialist say that they don't believe that fibromyalgia can happen in men. I was appalled. So we're going to change that language. We got to start changing it and start and saying, let both women and men of all ages and racial ethnicities get diagnosed with fibromyalgia. We need to do better at epidemiology studies. There's so much that we got to do. That's why we got to work together and collaborate. So it'd be important to just change the dynamic. And I'm going to be connecting with all of you today. I'm going to be jumping on. It is way too early for me. My dog is so upset because I woke him up. So right now it's 5:47 over here in California time. My brain is not working as it should, but it is Giving Tuesday, so we're rallying, right? We're getting a lot of people because I'm not going to just be jumping on the Support Fiber networks. I'm jumping on other accounts to reach the professionals, to reach the doctors. I'm going to be posting in groups to get these doctors to rally support around the fibromyalgia community today because it is Giving Tuesday. So we're going to be doing some education on other social media accounts where more providers exist. So we're going to be out there, but you can do this too, right? You can jump on social media if you have some providers, or you can talk to your providers and see how they would like to get involved. Because the great thing about the programs that we have at Support Fibromyalgia Network is that they're all collaborative. So, Rob, if you have a provider, I know you said a lot of the providers don't feel that it's real, but if you have friends or even allied professionals that you see, Project Echo is virtual medical education, virtual professional medical education, all for allied professionals. They get continuing, well, at least in the United States, we've figured out that they can get continuing medical education credits, continuing education credits for allied professionals. I'm trying to figure out what internationally people need, but this can go international. We can have a fibromyalgia spoke, or maybe even a hub, help someone in the UK build a hub to educate fibromyalgia providers in the UK specifically who understand the system, because the system is very different over here. And just understanding what it takes. And I know we have friends in New Zealand, Australia, Taiwan, India. We want to connect more. So we have some advocates in India. So we're growing, we're making the connections, and we got to just figure out how we can better work together and help create solutions. Yes. And actually, Mark, we are working on a list of doctors who actually accept fibromyalgia patients. So a lot of the lists are out of date. So, or a lot of, doctors have retired. We'll see how they continue. Or what we've noticed in the United States is that even the rheumatologists that are listed, they can diagnose you with fibromyalgia, but they'll defer you to primary care physicians for the treatment, which has been a new thing. It's been subtle, but if you read the American College of Rheumatology's website under fibromyalgia, that's what it says. So they're deferring to primary care physicians, and we've actually heard from advocates, we've heard from patients around the country here in the United States that they have not been able to get accepted to some of the university hospitals when they apply for seeing a rheumatologist because they have an existing fibromyalgia diagnosis. If you're not diagnosed with fibromyalgia, they will see you. But if you have an existing diagnosis without any other autoimmune or rheumatological condition, they will not see you, which is really upsetting because they're sending you to primary care. And we've never educated primary care physicians in the United States. We've always focused on rheumatologist education. That's where the hub of education came from for medical education. So that's why it's an important piece of the puzzle that we are shifting, right? And that's why Project Echo, it's free. It's free for providers to get involved, and they can get some education credit. They can learn from each other and other providers. It's through case-based learning, so we're taking out the bias. Yes, there'll be experts doing didactic and sharing their own case studies, so we're trying to bring in the fibromyalgia experts, to share their experience with the other providers, but the providers get to bring in their own case studies, and they get to all learn from each other. So what we're trying to do is take out the bias in that way as much as possible, because sometimes when you do education, there's one doctor teaching it and they have their own views about what fibromyalgia is. But with case-based learning, you're bringing in cases, all the PHI is taken out, and then we're learning from actual patient information. So do we see more inflammation going on in the diagnosis of fibromyalgia? Those are things that we're going to have to figure out. And yeah, I will definitely share a link to the Project Echo. We want to launch it next year. We've had difficulties, obviously, onboarding providers. That's why that is one of the biggest asks we have, even beyond dollar donations, is we need to get the providers involved. So if you have a great provider that wants to get involved, or if you have a provider that wants to learn more about fibromyalgia, please send them our way to join. It's a free program. And some of our experts too will also get paid for their time in giving the didactic. So we're creating a community that they can rely on. And from that mark, like, we're going to be building a list of providers that will get trained through the program, so that you know that they are currently accepting fibromyalgia patients and they currently support and are updated on the latest education. So that's part of it. Because like I mentioned, the lists are out of date. The support group lists are out of date. Everything is out of date right now, it seems. So we're struggling here, but we're going to be moving forward. And that's the positive part, because we have connected with a lot of advocates around the country. They all agree that we can move forward to make a difference within the fibromyalgia community. Oh, and I'm glad. Well, I guess deferred to pain management too is very tricky right now. So I'm glad that you got a pain doctor, which is interesting. And this is where I want feedback from all of you too. If you have a pain doctor, because they could join the Echo. We need their experience, right? We need everyone's experience to join what they say, different perspectives, because people assume they understand fibromyalgia, and fibromyalgia is so much more than pain, and especially addressing aspects of sleep, nutrition, microbiome, thyroid, hormones. It's very complicated, and I understand that one doctor could not be the expert. They try, but there's always like some sort of emphasis in some sort of area. And after taking the great course by the Karazian Institute, that man is a genius. I took the clinical aspects of managing pain and fatigue from their institute, and he has it dialed in. I wish every provider could take his course. It is great, and he has a turnkey solution for understanding the complexity of fibromyalgia. He said it's one of the most complex conditions on that spectrum with CRPS. So there's a lot of complexities to fibromyalgia, and if we're just looking at only one aspect, like if you're meeting a provider that just wants to treat your stomach issues or your gut health, you're going to be missing a whole broad spectrum of treatment. So we really need to change this. We really need to educate. And I've heard from some advocates who feel better, and it seems like there's multiple modalities involved and multiple healthcare providers involved. We have an interview with Jason, and he lives in Canada. So he had a team of people come together, and that's how he was able to feel better. So this collaborative aspect needs to not only happen within our patient empowered community, but a collaborative aspect in the allied professionals. So I am a board certified health coach. So I'm bringing health coaching to the program, and I'm learning and connecting with other clinicians so that we can improve the quality of life for all of you. And I'll be talking more later, and we have videos too on the health coaching program, more on Echo. So I'll be sharing, and I'll be sure to get you the links to Echo and how you can sign up. We need to get this launched. It's super important to improve medical education. because I know all of you need positive healthcare experiences. And if we can move the force forward for the providers, make them feel comfortable again, let them know that this is real and it's not a wastebasket diagnosis. It's something to really work on, right? We're going to eliminate and change that terminology altogether. We'll make a difference together. I appreciate everyone chiming in. I'm going to sign off and go and continue with the Giving Tuesday. I'm going to hit LinkedIn shortly because I have a lot of professionals and doctors and functional medicine providers on my LinkedIn account. So we're going to hit them big today on Giving Tuesday and ask them to give their time and energy and expertise and knowledge to get involved so we can change the landscape for the fibromyalgia community once and for all. Long lasting, sustainable change. That's what we're doing. And you're going to hear a lot from me today on unleashing generosity. So please do, if you can, there are dollar donations available if you can host a fundraiser and share with your friends. But the most important thing is always just to like and share our page so other fibromyalgia warriors know that they are not alone. And then if you're interested in getting involved, we would really appreciate volunteer more than anything at this point, because we got to grow. We got to grow and we got to make a difference and we got to be stronger together. So thank you, everyone. I will be back and forth. I'm going to give some major shout outs to our donors and people hosting fundraisers. I have a fun thing. It may involve a guitar. Who knows? I can't sing, but I can still play the guitar. So I will check in with everyone later. Thank you so much. Have a great and wonderful low pain day. And I will check in.